So we can talk about cupping for the low back. The cups that I'm using throughout these videos vary in size and just my own personal decision as to where I should apply them. The back is has a large area for a lot of people, so I can use a very large cup. But if I'm working with a smaller, more petite person, maybe I work with a smaller cup as well. So again, following a similar format, I can just apply the cup to a singular area first and work on, let's say she's got a little pain or restriction through here, we just allow it to stretch from one side. We can also apply a second cup to stretch from multiple angles. In her case, maybe we alter the angle of pull to allow that restriction to release in all directions. If we come back to the first spot, and again just reverse which cup is moving as we continue working on that restriction. Depending upon my patient's ability to move, we would add some sort of movement component to this, like extension, bending our back, or letting it bend forward, or pre-assessing her ability to move, treating, and then reassessing after. So I'm applying a little gel first to allow the cup to slide. So for many of my folks, they do have issues with movement. So maybe this is what helps them move a little more easily after. So I'll use the smaller cup, and I'm going to work up and down first. I'm listening to her breathing, making sure I don't hear any sudden clenches, and that she tries to stay relaxed through it. I can see a little redness beginning, and that's okay. We'll give that area a rest, and we'll move along the border of the pelvis. We then repeat on the other side. So I may feel that through here, especially along this upper level, there's a little more of a restriction. I feel like I'm being slowed down just a little bit. I start to see that she's getting red. So again, I switch to along the border of the pelvis. So this is the general treatment for the low back. As you can see, the redness on her left side is already starting to improve. It is not becoming as red. And as I talk a little longer, the redness along her right side is also beginning to improve. My goal in this treatment is to not have any lasting bruising after the treatment. Will you be red? Yeah, for maybe 10 to 15 minutes, maybe even 30. But this should fade by the end of the day. This should feel potentially like a very deep tissue massage, depending upon how much the cup collects. I can't adjust that pressure, but we should feel that you are able to move better afterwards. So she goes into extension again, and that looks easier than before. Stay tuned, folks. We'll have a couple more videos coming out for you.